we're going to discuss Marfan syndrome, a hereditary connective tissue disorder that affects multiple body systems, especially the skeleton, heart, and eyes. To understand Marfan syndrome, we first need to understand its cause. The disorder is inherited in an autosomal dominant pattern and results from a defect in the FBN1 gene located on chromosome 15. This gene is responsible for producing fibrillin, an important connective tissue protein. When the fibrillin gene is mutated, abnormal fibrillin is produced. Because fibrillin is essential for forming normal microfibrils in connective tissue, defective fibrillin leads to defective connective tissue throughout the body. This explains why Marfan syndrome affects many different organs and systems. Now let's look at the clinical features. The most striking findings are seen in the skeletal system. Patients typically have arachnodactyly, meaning long, slender fingers. They also show dolichostenomelia, where the limbs are disproportionately long compared to the trunk. Thoracolumbar scoliosis is common, and the face and skull are usually long and narrow, often giving an immediate clue to the diagnosis. An interesting historical fact about Marfan syndrome is that it has often been associated with the 16th President of the United States, Abraham Lincoln. Although a definitive diagnosis was never made, his unusually tall stature, long limbs, and slender fingers led many researchers to speculate that he may have had Marfan syndrome. Additional skeletal findings include hyperextensible joints, frequent joint dislocations, kyphosis, and flat feet. Although the skeletal features are easy to recognize, the most important complications occur in the cardiovascular system. Patients may develop aortic dilation, aortic regurgitation, and aneurysms. These are considered the most serious manifestations of the disease. Some patients may also develop mitral valve prolapse, which can become severe enough to require valve replacement. The eyes are also commonly affected. Ocular findings include myopia, cataracts, retinal detachment, and the characteristic superior dislocation of the lens. Now let's focus on the oral manifestations, which are particularly important in dentistry. A high-arched palate is very common and may even be a constant finding. Patients can also present with a bifid uvula and malocclusion. Occasionally, multiple odontogenic cysts may occur in the maxilla and mandible. Another finding that may be present is temporomandibular dysarthrosis. Radiographically, skull radiographs may reveal a high-arched palate, increased skull height, and an enlarged frontal sinus. Finally, let's discuss treatment and prognosis. There is no specific treatment that can correct the underlying disorder. Management focuses on monitoring and treating complications, especially those involving the cardiovascular system. Fortunately, advances in cardiovascular care have significantly reduced morbidity and mortality. Today, many patients with Marfan syndrome can achieve a lifespan approaching that of individuals without the disease. However, cardiovascular complications remain the most common cause of death. So, if you remember only 4 things about Marfan syndrome, remember this. FBN1 gene mutation causes defective fibrillin. Skeletal features include arachnodactyly and long limbs. Cardiovascular complications are the most serious, and a high-arched palate is the most common oral finding.